Welcome to Speaking Freely. Nearly 2 years after the COVID pandemic began, the question still remains: what have we learned from our collective experience? What have been the successes and failures in our collective response to the virus? And now, in 2022, have we finally arrived at a place where we can safely say that COVID, as a serious threat in our daily lives, is mostly over? How do we as individuals reconcile a sense of post-Omicron freedom when people, sometimes those double vaccinated and boosted, are still testing positive for COVID and in some cases also falling ill? Well, on today's episode, we'll be dealing with these issues head on in a show we're titling, What's Canada's COVID Exit Strategy? We'll be speaking to three people: Dr. Jennifer Grant, an infectious disease specialist and clinical physician from the University of British Columbia; Professor Trudo Lemmens, Professor of Public Health and Law from the University of Toronto; and Professor Dionne Pohler, interdisciplinary social scientist and labor market specialist from the University of Saskatchewan. These three experts will help us understand whether the COVID zero strategy that was pursued in many parts of the world, and to a large extent in Canada as well, was worthwhile. Our experts will also help us understand whether the cost of lockdowns and school closures, for example, outweighed any of the purported benefits in terms of lowering COVID exposure risk and reducing COVID spread. And by costs, I want to be really clear here. We mean costs measured in overall health, not just in lost GDP, though of course that might matter too. Well, it turns out that young people from the start of the pandemic were at far lower risk of severe outcomes than the very old and infirmed. It also turned out that those in care were also at far greater risk and bore the brunt of mortality from COVID since the start of the pandemic. And here we can include our seniors in long-term care, but also those working in hospitals and struggling with other diseases. But in our effort to eradicate COVID and prevent it from infecting all Canadians, did we actually do enough to prevent the most vulnerable from being infected and falling seriously ill? One thing that was and still is clear is that children, particularly elementary age kids, were at far lower risk from COVID than even typical influenza. Children also, the evidence showed, were at far lower risk of transmitting the disease to adults. In fact, they were more likely to contact the virus from their parents than the reverse. And yet, was any of this evidence of school safety looked at when schools were shuttered around the country? Not once, not twice, but in jurisdictions like Ontario, shuttered 3 times. Well, these are questions that require answering. Otherwise, we might just stumble into the next pandemic and have to learn some of these hard lessons all over again. So join us after the break as we ask the question, what's Canada's COVID exit strategy? Welcome back to Speaking Freely, where today we're tackling the question of Canada's COVID exit strategy. But of course, before we get into that, we have to know how Canada entered into the COVID pandemic in the first place and some of the policies and actions that were taken for the past 2 years. Have we learned anything from those actions? And I want to start with Dr. Jennifer Grant, who's provided us with a real interesting window over the last 2 years through her articles, her public interventions on just how maybe we lost the plot somewhere along the way in our COVID strategy. So Dr. Grant, can you just walk us through over the last 2 years, maybe some of the things that governments did, public health authorities did, that maybe at the time might have been reasonable, but which maybe lost their rationale somewhere along their way?
Sure, and thank you so much for the question. I do want to point out that I'm here representing my own views and not those of my institution. I think of sort of 3 things that came to mind when you asked that question. And the first really was we really needed to be very clear about what we were trying to achieve. And that needed to be explicit, and it needed to be reevaluated if it became clear that that wasn't something we're going to be able to accomplish. So we sort of started into COVID thinking this was like SARS-CoV-1, which we actually managed to get rid of. And I wish we could. I wish I could wave that magic wand and make this virus disappear. And early in the pandemic, I don't think it was unreasonable to try for that. It's certainly the standard approach to an epidemic is to try and eliminate first. But what we didn't do is start looking at the evidence as we move forward, realizing that our aims of the measures we were introducing, whether they were achieving what we wanted to. And so the COVID zero, I think, was a very reasonable thought. I don't think it was unreasonable. It was certainly something to consider. But as we've moved forward through the pandemic, after the second and third waves, it's become increasingly obvious that this is not a virus that we can eliminate or eradicate. And so a number of the measures to try and do that need to be reconsidered. And we need to refocus our interventions to something that's achievable and for which the benefits outweigh the risks. So that's sort of the first thought I had. The second thought is really about understanding the risk gradient of this virus. It was obvious, even from Chinese data in 2020, that young people in general, and children in particular, are not at significant risk of massive adverse outcomes. And so we really needed to focus our public health strategy on making sure that we put appropriate interventions for the risk experienced by any part of the population. And young people, I think, needed to be given a lot more freedom than they were. And the third thing is we engaged in massive shaming and blaming. That's something that we learned from the HIV pandemic, that you don't actually win by making people feel bad, by blaming them. You get much more benefit and much more sense of esprit de corps if you include people in their own decisions. You accept that some people, for whatever life circumstance they have, are not going to be able to do what you've asked of them, and making sure that we take care of those people too.
That's well put. I just finished reading the book, How to Survive a Pandemic, which came out in 2017, which is exactly that story of the AIDS crisis and how many mistakes were made then. And you're right, we seem to have repeated them again. I want to move next to Professor Pohler. Dionne, you might want to also look back over the last 2 years and cast your gaze on policies that you think, maybe in retrospect, were not well thought through or that proved to not be as efficacious. Do you have any thoughts on that perspective over the past 2 years, things that you could have seen perhaps done better?
Well, I think building on Professor Grant's comments, I think they really flow from some of the challenges that she identified in some of the responses, especially the policy responses. I think her point about more freedom should have been given to young people. I think one of the biggest missteps in the pandemic was really the closing of schools, especially for as long as they were closed. I think that that's going to have very long-term consequences for children's educational outcomes, for their labor market outcomes in the future. And I think we're just starting to see the impacts of those things now. And I believe they're only going to get worse, especially for children that are at higher risk to begin with. I think that was one of the major missteps. And I think another major misstep was actually around vaccine mandates and passports. Again, to Professor Grant's point about coercion and blaming, and I think this is probably one of the other major missteps that first, I think, was to some extent sanctioned by governments in implementing passports at different points throughout the country. Different provincial governments implemented them at different points. I think at the point in the pandemic that they were implemented, we already knew much about the fact that the vaccines were not stopping infection and spread. And so I think that made them even worse because we implemented them knowing that. And I think, really where they became very problematic was when employers started implementing them in a widespread manner. So people's jobs were on the line. That ramped up the coercion at a level that I've never experienced in my lifetime in terms of requirements for vaccination. It was unprecedented, really, for employers to implement vaccine mandates to the extent that they did, and the implications that had for people's jobs, for their livelihoods. There were studies done around who was less likely to be vaccinated. And so the people who are more likely to be coerced to get the vaccine to be able to keep their jobs were lower income, had higher levels of financial instability. In my own province in Saskatchewan, more likely to be Indigenous. And I think that just in general, underpinning all of this throughout the pandemic, I think at various points was the belief that one technology could save us at any point, right? This idea that implementing lockdowns, that was going to, fix everything. Implementing the vaccine mandates, employers did that thinking they could bring everyone back to work more quickly, more efficiently. I think it was that sort of idea underpinning all of these problematic missteps, this idea that just this one thing or this major thing would actually do it and get us back to normal, get us flattening the curve and then eradicating COVID at one point. And I think that speaks to Professor Grant's point about what was the metric, what was the goal, and the goalposts kept moving. And I think that was another major misstep.
Right, well, building on that point of the one next thing, we forget also about travel bans and quarantine hotels, sick leave pay. All of these things were trotted out as the thing that would end the pandemic, and they never clearly did. I want to bring in Professor Lemmens now. Professor Lemmens, you actually written on the topic many years before of ethics and the conduct of public health in times of crisis. And you most recently wrote a very well-regarded and cited paper that's in a preprint stage with several co-authors on the legality, on the kind of legal basis and even the kind of rational basis of mandates at work. Do you want to speak to that quickly?
Yeah, so I agree with Professors Grant and Pohler about what we learned from the pandemic of what went wrong. And so in the early days of the pandemic, I participated, for example, in with a working group looking at the role of family caregivers in elderly homes. And if I can start with some things that we clearly have done wrong, I would emphasize the way in which sometimes measures have been implemented early on in a very aggressive way, without actually, I would say, taking the time to sit back, consult with people who were the most directly affected and who actually could speak from their knowledge of being involved with, for example, taking care of elderly. I think about the way in which people have been excluded from elderly homes in the early days of the pandemic. In elderly homes where they were playing as family caregivers an essential role in providing care in a way that if you look back at it, you kind of wonder how it was possible that policymakers and expert committees could not take the time to look at. So what happens when we exclude people who are taking care of loved ones in elderly homes? We will have in commercial elderly homes people traveling from home to home, so specialized paid nurses rather than relying on family caregivers who go directly into the home. So some measures were taken without consultation, without really taking the time to sit back, very aggressively imposing exclusion from elderly homes. I wanted to put that out there. You asked about my paper, but we didn't discuss that particularly in the paper. But I think there's some of these examples of policies that were implemented that from a public health perspective seem to be completely irrational. So in addition to the sometimes strong approach that has been taken with respect to exclusion in the workplace and so on, but I wanted to emphasize that one particularly as well.
Professor Lemmens, I wanted to actually draw a line right there on that point about the nursing homes before you engage with the other things that you've worked on. I think it's actually quite important. We forget the first 3 or 4 waves, in fact, continue still. The mortality rates amongst people who are affected with COVID, who are dying from COVID, are highly skewed towards this older age group, but mostly people who are in nursing homes, in care. And you're right, the very first waves of COVID, the mortality rates in nursing homes were precisely so high because there was no one there to care for them. The military that was called into Quebec in Ontario wrote a report, essentially identified that people were essentially not cared for, they were dehydrated, they lacked food, their beds hadn't been cleaned, and those large waves, especially in the early part of the pandemic, were directly linked to what you've just mentioned.
Yeah.
I think
even also simply so even from a prevention perspective, the people who were replacing family caregivers were nurses who were traveling from one home to the other. So from a epidemiology perspective, it was actually quite hard to understand how people didn't think that through carefully.
Yeah. Okay, we'll take a break right there. And when we come back, I'm actually going to start with you, Professor Lemmens, to just discuss the other work you've done in this area of COVID policy, especially as it relates to the workplace again, and matters related to legality of mandates and also their efficacy. So when we come back, we'll get into the discussion once again. We're outside of Miami Wings Pub House in North York, Ontario. We'll be talking about COVID, specifically COVID policies over the last 2 years. Which ones have worked, which ones haven't, and what's the best route forward?
What we've learned in the last 2 years during the pandemic is that all those times of partying and going out and even just having dinner with your parents are the most important things. And now that we haven't been able to do that and we finally can, we really miss it. And we're so appreciative of all those special times.
That we got to think for yourself. We got to be our own person, and we can't necessarily trust the government on all these issues.
I think fiscally is actually, the COVID has actually made me realize and look at my personal finances and realize that I was living outside my means and not being responsible. And I think it brought me and probably a lot of people back down to earth about, being just, like I said, responsible in how they spend and keeping track of where it's going, right?
A lot of people need to reevaluate their critical thinking because they really fell into this lemming mentality where, a lot of people just, they follow the rules. Not that it's a bad thing to follow rules, but there was not a lot of independent thought and not a lot of diversity of thought and also critical thinking in the sense that people who had unpopular opinions often got quashed. And so I think that we need to learn how to dialogue with each other more as people who have different opinions and to be able to work on our critical thinking more in that area.
Not really. I was fine with all the policies, including the mask policies. I thought they were fine, but I can understand how some people had problems with them. I understand the point of vaccine mandates, and I feel like everybody should have their own right to choose whether to get vaccinated or not. But I understand the purpose of vaccine mandates, and I think personally they're good. They do more good than bad.
Maybe the constant back and forth between, hey, I'm going to open up now and everything is okay to be open, and then kind of falling back a little bit, maybe 2-3 weeks later, because there's now been another huge outbreak. And that kind of screws me up a little bit because at the time when it started, I was at school. So it's just like, hey, yeah, we can open up. So I ended up driving to school for an hour, going up north. And then it's like, oh yeah, actually there's been another outbreak at school. You can't go back. And then it's like a back and forth. It's like, okay, I was prepped and ready for in-class learning, but now I'm not in class anymore, so.
I think it's really difficult for us to judge what policies were put in place that put some people at a disadvantage and others at an advantage. Look, it was a really difficult time. And so I'm not gonna pick on what policies were put in. The other thing I like to say is we're all in a different boat. Some of us are on a canoe and some of us are on a yacht. And so as we sit on our boat, let's just be aware of that and help those that we can, if we can. Enough, let's stop complaining and move on with life.
Number one, did they force us to get vaccinated? Literally forcing us, even though they kept saying, no, they're not. Oh, yes, they were. If you didn't, you can't do anything. You can't fly, you can't take a train, you can't go to work in many institutions. So yes, that was the biggest one. And people fell for it. Most of the people think that it's right because that's what's going to get us out of this pandemic, which they promised it's going to take 2 vaccines to do it. And meanwhile, it's been already the 4th vaccines, and we never had such a bad pandemic. And right now, everybody's quiet about it. That's all.
Well, it's been tough. I feel sorry for everyone who was adversely affected, but what happened? A lot of people suffered because of that. Restaurants, not that they're the main complainers on TV, but there's lots of people who suffered that you don't hear about. And those, that's the main problem with it. And it's terrible, really. If you look at the States, Florida, having gone down there, they're open, and their consequences are basically no worse than our consequences. Yeah. So whoever made those decisions made them probably in good faith, but they were devastating to some people.
Yeah, 100%. So I think the working class for sure. So most of the people, who are more well off, they were able to find ways to make income regardless, even during the pandemic. So they could work from home, they were able to start side businesses, they had more time, if anything. People, the working class, companies don't really think of them, right? They're just manpower to them. So a lot of these people got laid off when work wasn't coming their way, especially those like First Nations people, because of all the policies and how the entire economy was down, they had it really rough as well. So yeah, definitely the people, the working class and the lower class families for sure.
Maybe depending on who was more prepared, maybe certain workforces. So it's maybe trades. Trades may have been a little bit more well off because they were allowed to stay open, but other smaller businesses, like personal run businesses, probably got the short end of the stick at the end of the day because they were limited, like restaurants even, right? Restaurants, you couldn't go to a restaurant because everything was closed, but grocery stores were allowed to stay open. So depending on how you look at it, I would say, yeah, they probably weren't treated as equally as they were.
I think it's been a time that we can all kind of reflect and know what's important for us. Little things like going to the gym, going to the grocery store, being able to spend time with our family will never be taken for granted again.
We've heard from customers and business owners alike. The last 2 years have been hard, especially for small businesses like these that bore the brunt of lockdowns, especially early on in the pandemic. If we've learned anything over the last 2 years, it might be that we have to speak to small business owners before we make policies in which their livelihoods and the lives of their customers are so profoundly affected. Welcome back to Speaking Freely. When we last took our break, Professor Lemmens was talking about the problems we saw in our nursing homes, especially during the first several waves of the pandemic, and the kind of bizarre policies that shut out family caregivers who were there to take care of their family members, but allowed overstrained and understaffed care workers who had to work 3 or 4 different shifts in different care homes and thereby spread the virus to multiple places. Professor Lemmens, do you want to pick up on that point and just raise a few others, kind of looking back at the last 2 years and what you saw as kind of missteps?
Yeah, so that particularly that issue of the long-term care homes and the exclusion of family and caregivers was an example of how, with little consultation of those directly impacted and those directly involved in care, we've often implemented policies that seemed from a distance to make sense. But I also think about other policies, the ways in which isolation policies, the ways have been implemented without taking into consideration the particular position of marginalized communities. So I think in the early days of the pandemic, how people were receiving tickets for sitting on a park bench. So you had, this didn't happen so often, but still there was this very, very strong hammer approach to pandemic control that didn't take into consideration, for example, that many people in marginalized communities had no place to go, had no place to turn to, didn't necessarily have immediate access to public parks, were living in small quarters, often with large families and in small apartments. And so the kind of consultation that you would expect in terms of looking at what's possible, what will work, how can we build trust with the community. So it links to what my two colleagues have been saying before, a radical departure from a public health approach that emphasizes the need to build trust with communities and involve communities in public health measures was abandoned. Another point I would want to emphasize is what I've seen generally in public debate, particularly in the media, certainly social media, but even in academia, a reduction of science to a field of human activity that was uncontestable, clear, and unquestionable. And within the scientific community, obviously, people know that this is not the case, but it was very, very hard, even within the scientific community, to continue to raise questions once there was a perceived need to have a uniform messaging. And so it led, I think, to a false portrayal of science as unquestionable, as certain, as completely reliable in all circumstances. And so it connects to this idea that there was this perceived of, we need to have uniform messaging. And when there is this perception of the need for uniform messaging, critical questioning is pushed aside. There is a lack of acknowledgement of complexity and uncertainty. And it's obviously hard to deal with that, but we should have done a better job in conveying that to the public. The last thing I emphasize, and it's certainly related to some of the things I've worked on before, is that we haven't taken decades of work on issues around pharmaceutical governance and pharmaceutical regulation seriously. And so suddenly it became impossible to question the way in which vaccines were developed, the ways in which scientific knowledge is being pushed in scientific journals. So a lack of critical engagement with reasonable questions about, do we know enough about safety and efficacy of drugs, vaccines? Do we have a good adverse event reporting system, and so on? So I think these are the kind of the main issues that I would emphasize, in addition to the ones that were raised before.
Excellent. Thank you so much, Professor Lemmens. Dr. Grant, just back to you quickly. I mean, you're an infectious disease specialist and physician. So for you of course knew the dangers potentially of a virus that was new to the human genome and condition, and yet you have been one of the voices that has sort of tried to tame and calm the most vigorous, I guess, efforts to, I guess, achieve a zero COVID outcome, at least when it was reasonable to conclude that that was impossible. I just want to see how you came to that realization, and some of the work you did with Dr. Martha Fulford from McMaster University has also emphasized that public health is broader than just trying to eliminate one disease, right? We have to think of everything else. So I wonder if you can speak to those issues.
Absolutely. So I think after the eradication of smallpox, which is the only viral disease that's ever been eradicated that affects humans, there was a lot of work done to try and understand, well, what are the conditions that allow us to eradicate a virus? And there are 5, and I'm not going to be able to list them off exactly, but fundamentally, you have to have something for which you have a sterilizing means of stopping transmission. That's, in the case of smallpox, is a vaccine. We do not have a sterilizing vaccine. We have a great vaccine for preventing severe illness, but it does not stop transmission. We can argue over the degree to which it slows or reduces transmission, but it clearly does not stop it. You need to have a disease where whenever you're infectious, you can tell with symptoms. And we don't have that with COVID. There's a lot of people who have COVID and are completely unaware. A number of people I know have gone on vacation and been tested on their way back and found out that they actually have had the disease and been completely unaware. So you can't pick it up while people are infectious. It has to be something where there isn't an animal reservoir. And I can't count the number of animals that they have identified that can carry this virus, but they're legion and all over the place. And in fact, there was a lovely article that looked at houseflies, and they were able to detect viral nucleic acid in flies. So this is a very not a very picky buyers in terms of hosts. And so all of that sort of combines to the fact that it just even if we could eliminate this human, it's back and the other is countries where people don't have the capacity to shelter in place, people who are living on $1 a day or whatever the financial equivalent is, who must go out and work or they starve to death. And we can't ask those people to sit still and do nothing. That's not fair. And we're also not able to provide a vaccine, even if it were a sterilizing vaccine. We certainly haven't prioritized it. And that's a whole other discussion about to what extent that should be done. But even if we were to eliminate it in the Western world, it's going to come back from somewhere where it hasn't been controlled. So I think all of that comes to say that this was not something that we were going to be able to eliminate. And then it becomes a question of, okay, if that's true, then the truth is we will all be infected. We will, there is just no way around it. And if you look at the biology of other coronaviruses, this is actually fairly typical. It's quite common to be infected several times, even within the same year with the other 4 endemic coronaviruses. So it didn't seem like we were going to be able to get rid of it. And the truth is the history of these things is that they become milder and milder over time, which is probably where we're sort of heading. So then the cost of the interventions have to be weighed against the likely outcome, and they become quite futile if it's clear that you're just never going to be able to stop transmission.
Yeah, wow. You actually went through that very quickly but efficiently, and first time I've heard it put so succinctly. I understand now why some of the infectious disease specialists, like yourself, were kind of raising some alarm bells once we knew that this was not going to, the genie was not going to be put back in the bottle. Professor Pohler, I just want to move to you quickly. If you can just quickly talk a little bit about that cost-benefit analysis, if you will, you might be familiar with, with regards to policy. If you can just tell the audience very quickly that there are unintended and intended consequences, and I wonder if you could speak to that idea, just briefly.
Well, I think one of the things about the unintended consequences is that oftentimes we do something with the best of intentions, right? And we want to meet a certain objective, but because we don't think about all of the ways that our actions can actually create other types of problems. So for instance, in the lockdowns, right, that destroyed the labor market. There was the hugest shock to the labor market. People didn't have income, people had to pay their mortgages, people had to pay their bills. So of course, then the government has to implement massive income support programs, right? And then they're trying to design these programs on the fly. And then there's a whole bunch of consequences surrounding the implementation of those programs that we're now still just trying to sort out, including trying to actually move away from those programs at some point. And how do you do that? And how do you transition people? And so it's just one of the things that I have learned over time is that many of the things that we do in terms of interventions are never quite as effective as we believe they will be. And they almost always have unintended consequences that we don't really, maybe we should have anticipated, we should have known that these things would happen, but we don't plan for them very well. And we don't then know very well how to solve the kinds of problems that arise because of the interventions that we've undertaken. So I think just being really careful and thoughtful and thinking about how you balance different kinds of objectives, even in the height of being very not knowing what to do in a situation of a great deal of uncertainty. I think having a set of objectives that you're trying to balance rather than one objective that you're trying to meet at all costs is always going to be a better way forward.
Well, Professor Pohler, on that point, I'm just going to stop you there, but we're going to take up this question of then what to do and how to better anticipate the intended and unintended consequences of our actions after the break. So join us. Well, we're back on Speaking Freely. And I want to start with you, Professor Pohler. Let me just put myself in the shoes of our elected leaders over the last 2 years. Given what we've heard, if I were to tell the audience and the electorate that there's really nothing we can do to stop you from getting infected, that might not fly, right? And I think, to be fair to our elected leaders, they were pressured and cajoled into doing something. So if you were to think about that something, think about the thing that you would have recommended if you were in that position. What policies could we have taken that would have been better and that wouldn't have kind of caused more harm than the benefits that they produced? So think about that kind of question, if you will, and provide us maybe with your take on it.
Well, I think one of the things that I would recommend to policymakers first and foremost is to actually acknowledge the uncertainty. I think that people will accept when people don't know completely what should be done, and that we might have to change course as something like a pandemic evolves. So I think being honest with the public about that is really important, and avoiding the what we call noble lies. There were a lot of things that policymakers said and did, and public health officials and even academics, I think that kind of really didn't acknowledge the uncertainty, and also I think emphasized certain things in certain ways that actually people came to understand really weren't accurate. I mean, there are great examples even still coming out in the media from public health officials in my own province. A medical health officer of the Saskatchewan Health Authority the other day, there are COVID hospitalization rates at record numbers. There's documentation that this is incidental COVID, that majority of these cases are not people being admitted for COVID. But then the public health official is saying, that this is misleading, and there's actually a very small number where COVID may be truly incidental. So I mean, how are people supposed to sort through these kinds of things? So I think being really honest about, what data you have, what you know, and what you don't know, and I think is one of the most important things that policymakers can do in these kinds of settings.
Okay, so more honesty, transparency, and an admission that we might not have all the answers. Okay, Professor Lemmens, to you, the same question. What might be a policy response if we think about the future? If we've learned from anything from this past 2 years, that I think would make everyone better off?
That's a very difficult question because there's so many different things to decide. And I would say that in Ontario, particularly, we've been confronted with reaction by the government who actually, which tried to avoid democratic accountability by sending to a science advisory committee the message to and via the public health agencies the message to employers that they had to take responsibilities that exceeded actually what we normally would expect from employers. And so I think that was an indirect, undemocratic way to try to enforce public health policies for which the government itself didn't want to take full responsibility. And unfortunately, even our academic institutions just basically accepted that and started imposing mandates that, in my view, far exceeded what you could justify under normal employment required policies, which is policies that focus on workplace safety and the safety of students and staff in a university setting. I mean, I think about the absurdity of the fact that we have colleagues who have been suspended from their job, fired from their job even, simply because they did not want to be vaccinated, and they may have had personal concerns about family-related concerns about the potential adverse reactions. And some of these people were not teaching in person or were actually even on leave. So I would say a much broader debate in democratic setting at a policy level, but also then employers, particularly also academic institutions, being critical about the indirect obligations they received or the indirect public health mandate they received, and being critical of what policies seem reasonable in the circumstances.
Yeah, it seemed like it was the employers that had to take care of our public health system rather than the opposite. It's like we were all taking care of our public health system as opposed to the public health system taking care of us.
Well put. And then also indeed connected to that, this idea of that there had to be uniform messaging. So employers not having the guts to stand up and say, well, there is something illogical here about some components of the policies.
Yeah. Dr. Grant, I just want to wrap up with you. You were in BC, of course, and actually for the large part of the pandemic, I think it was generally understood, if anyone cared to look, that BC had somehow gotten things right. The first wave didn't hit the nursing homes the way it did at Quebec and Ontario. In fact, it was, correct me if I'm wrong, but BC opened its schools back in June 2020, when also it looked at the evidence. And it seemed like young people, and especially children, were not at risk. Kind of what happened in BC there, and what, again, kind of taking the same question, what would you advise governments to do going forward?
Thank you. And this is a great opportunity for me to give a really big shout out to my colleagues at the BC CDC, who from the very beginning of the pandemic created the Unintended Consequences Task Force and started recording some of those and looking at some of those issues. And there are reports that are available online, sort of looking at the harm to children and families, looking at some of those other issues. And one of the biggest issues during the pandemic, at least in BC, is the overdose crisis, which has ballooned, unfortunately. People using alone, people not feeling comfortable to go outside and be where somebody might find them if they happen to overdose. So those data are all available on the BC CDC website. And I think having that lens really did help try and balance the, yes, we want to get rid of this virus and take care of people, but also we have to think about the rest of society. And the school data were crystal clear. They were very well done and documented and funded by not only BC CDC, but my colleagues at BC Children's Hospital. But what's interesting, and I think this is something to move forward, is that despite having clear data, despite having very good reviews, there has been a lot of challenges in publishing some of these correct, but unpopular opinions, especially in North American academic journals. So while it's not a government policy issue, I think academia really needs to take a step back and really reassess to what extent politics is playing a role in science. So I think that's one of the takeaways. I want to say for the long-term care thing in BC, one, we never stopped. We kept our care levels the same. So I think that and I was involved in this work, we did a lot of reassuring of our care aides to make sure that they felt comfortable. We stood side by side with them in nursing homes when there were cases, and we helped walk them through how to protect themselves. And the other thing that I think really made a big difference is the one site order, and that came down very, very quickly. And so people worked on one site; they weren't moving from site to site, and I think that made a huge difference.
Absolutely. I want to thank you all for your time today. This is a very important topic, I think, as you know, and even as we're engaged in a sort of COVID exit strategy, we still read newspaper headlines that say, well, we're still in a 6th wave, possible 7th. It seems like COVID doesn't want to leave us. But if we've understood anything, that's probably true. And it's us that maybe has to leave COVID. So I want to thank you all, Dr. Grant, Professor Lemmens, and Professor Pohler, for your time today and your bravery, because as you mentioned, many academics stood on the sidelines during the past 2 years, never questioning. And you were all, three of you, brave enough to raise questions. And that's all you did. You raised questions and offered solutions. So I want to thank you all for the work you've done, not just for your own institutions and your own provinces, but for Canada as a whole. So when we come back, I'll have a few words to wrap up tonight's episode. So that wraps up our episode of COVID Exit Strategies on Speaking Freely. I want to thank our guests, Dr. Jennifer Grant, Professor Trudo Lemmens, and Professor Dionne Pohler, for helping us better understand our country's journey through the COVID pandemic. And perhaps more importantly, for suggesting ways in which we might be able to move forward. Clearly, the pandemic has had a profound effect on our society. It has forced us to balance issues of freedom and personal well-being, and even free speech against public health concerns and what constitutes the common good. As individuals, whether we're young or old, or whether we're healthy or have medical conditions that make us susceptible to infection. Our own opinion of how COVID was handled by policymakers, I think, is shaped by these personal circumstances. Though all of us have weathered the past 2 years together, our own experience with COVID has varied enormously. And I think it's because we maybe see the threats posed by COVID differently that we sometimes can lose sight of the bigger picture. That public health is about reducing all harms, not just one, and we should always be promoting overall well-being by attending to the social determinants of health, which include meaning, human contact, and purpose in our lives. Strong emotions can sometimes blind us to the experience of others. That's why I'm grateful to have been able to speak to 3 experts in the fields of infectious disease, public health, law, and the workplace. Each one brought something different to the table, and as was emphasized several times, it's only through dialogue and questioning that we can shape better public health outcomes in the future. So thank you for sharing your time with us today. We look forward to seeing you again soon on Speaking Freely.